94.1 WHRP, Tony in the morning and DJ Primetime 256. It is Wednesday, hump day, but not just any hump day, Wellness Wednesday with Dr. Whitney West. Good morning, doctor.
Good morning.
Morning, Dr. West.
Good morning.
Now, the proper thing is to ask the doctor, how you feeling today?
I'm great.
Fantastic. It's good to hear. We got a lot to talk about, and I know this is always a topic of conversation. I know when I visit my doctor, my primary, I have questions, and sometimes I get these questions from online services such as Dr. Google and maybe even some medical advice from TikTok these days. How is that affecting, some of the patients that you've seen? And what is your advice about getting information from Google and some of the social media platforms?
Well, it's funny. I had a patient like last week who came in and she said, "You're going to be mad at me." And I said, "Well, why?" Because I got my information off of the internet, right? So we were talking about, so our previous segment, we talked about the vitamins and supplements,
right,
and how patients don't tell you. And she said, and I said, so she was taking a supplement that she didn't tell me she was taking. We finally, it came out, right? And I said, "Who told you to take that?"
Yeah.
And she says, "Well, you're going to be mad." It was TikTok. So it was a TikTok doc. Right. TikTok doc was on there and recommended that she start taking the supplement. And I said, okay. And then we got had a long conversation about it. And the thing is, I would have recommended it for her as well, but she had no kind of real guidance. So, the docs on the internet, I think some of them do it for to get more patients. They give general information. So it's not specific to the person who's watching it. And some of them aren't giving correct advice, right? So the thing is, patients look at that as, unfortunately, the gospel truth. And especially with OBGYN, they will go to the internet before they come to us as gynecologists. So they'll do like this long route. They'll talk to their family. They'll talk to, so another friend who might be in the health, like a nurse friend or something like that. And then they get on the internet and they go down the rabbit hole of "you're going to die," because at the end of everything in Dr. Google is death, right? You can, you could have cancer, you could have this or whatever. And it may just be something very simple that can be taken care of if they go in and see their doc. Now, I have no problem whatsoever with patients who want to research and who want to be informed about their condition or potential condition, because at this point they haven't been diagnosed, right? They're diagnosing themselves, on the internet. I have no problem with them coming in and us discussing what their concerns are and kind of coming up with a plan that everybody can live with or work with or whatever. But when they come in and say they've been following the plan off of Dr. Google, and they challenge the doc that they're talking to, then it makes it a little uncomfortable. I've had 27 years experience. I've seen thousands and thousands of patients over those 27 years. And I read journal articles and I've read textbooks and that kind of thing. And again, with clinical experience, you come up with different techniques and different things based on what we call just evidence, like research evidence that we have that proves right. Studies have been done, and we that's how I try to manage my patients, is based on the evidence-based medicine. So, and when they come in, we don't know what website they went to on the internet, or where that doctor is coming from on social media. So we don't know what their background is. So we just know that they're putting this information out and saying, "Patients, you need to take this, because of this," but they don't know what their specific issues are. So it's a little disconcerting for us as clinicians who actually are, trying to manage patients the right way. Obviously with the patient's input and, finding out all the information and what their other health conditions are that could impact what they're doing with the information that they get from social media.
Talking to Dr. Whitney West, we're talking about those of you who have been diagnosed by way of Google and or TikTok. And these are random medical, ideas of how to cure your situation. And if you're not seeing your doctor per se, and those are the people who have your medical history, you're gambling and you're taking a chance, and you could be doing more harm than not. So I think that the inspiration here is to, before you start following advice from people who don't know you or know what your personal issues are when it comes to your health, maybe you should talk to your doctor before you follow Dr. Google, who probably doesn't even know where you live. Okay. Talking to Dr. Whitney West, it is Wellness Wednesday. And you're saying, like, people get advice and you are open to the research idea that many patients do. What would be the advice if they found something out on Google or any other platform? Would it be like, come see me before you try that trick at home?
Basically that's, I would definitely do that. If you think you are having whatever the symptoms are that they're talking about on there, and they're, recommending the specific treatment plan, then you need to be seen. And, unfortunately, Western medicine doesn't do a lot of prevention. Like, we end up with, like, we try to go backwards and figure out, you've got these things happening. How do we treat that, as opposed to prevention? So if you're sitting there and you're watching, a TikTok doc who's saying some things, and you're like, well, I don't actually have that yet, but I don't want to get it. Then if you haven't had a follow-up with your doc recently, like in the last year or so, then I would say, reach out and go in and say, how do I prevent this from happening?
It's Wellness Wednesdays, and we're talking to Dr. Whitney West about Dr. Google or the TikTok doc advice. My question for you is, what is the primary difference between Dr. Google and Dr. TikTok, and going to your actual physician that knows more about you?
Well, Dr. Google, and of course, everybody knows that this is just a term that we use to discuss how patients find information on the internet, right? It's just it's a faceless, non-connected kind of situation where you're going in and you're just looking up, you're putting in symptoms, which could really be multiple different, disease processes, right? Doesn't mean that's what you have. The TikTok doc is just doing a video based on what they decided that was the topic of the day. And you may or may not see yourself in that information. Again, I won't call them faceless, because yes, they have a face, but they're not your doc. They're not your doctor who knows your information. And there's no accountability, right? You're putting out that information and the patients go use it. They can't come back and say, I used it and I had a side effect, or I had something. So you have nobody who's kind of managing you or monitoring while you're using this information, or the treatment plan that they have suggested. It's just the video that you watched.
And I think that's what the issue is that they have testimonies from people saying, hey, this happened to me, and I started taking this, because they're selling things. And then people are like, oh, that helped you. I got the same symptoms, so I'm going to purchase what you got that helped you overcome whatever that is, opposed to going just to their doctor. And I don't understand it either. I don't know why we've gotten to this, lifestyle changes or decision making when it comes to our health. But I'm with Team Dr. Whitney. Go see your doctor, please. Your best girlfriend always goes to see her doctor and sits down and talks about everything that's happening. And if I do have a symptom or something like that, I'm just telling you, me personally, I think it's all entertainment. We know that Google's one of the most, the biggest search engine that we have, so everybody's familiar with it. But just a little best girlfriend advice: go see your doctor. They know more about you than the people on the internet. Dr. Whitney West, how can people get in contact with you?
My website is www.westmdpc.com.
And any parting words?
Empower Wellness. It's a journey, not a destination.